Hi, everybody. I'm so glad to be with you today. And as a pediatric adolescent nurse practitioner, as well as a psychiatric nurse practitioner, this is a real area of specialty and passion for me. I have treated throughout my career so many children and teens with depression and anxiety and worked with so many parents that I am going to give you some golden nuggets today on this topic. I can't believe we're already through Stay Calm and Well Series 2. We are already planning Stay Calm and Well 3 and some other very exciting programming. I also want to let you know, though, that I am the mom of 3 daughters myself, and I never raised children through a pandemic. And I really want to say, I so empathize with all of you parents who are trying to juggle work and raising your children, as well as helping to homeschool them. So last week, Jackie Buell did a fantastic lecture on nutrition, and I hope you did your skills building. Please remember to eat your colors, and losing weight should not mean eating really low calories. Well, COVID has triggered a mental health pandemic inside of the COVID-19 pandemic. We are seeing such a rise in mental health problems, particularly anxiety and depression as a result of the pandemic. But we're also seeing a decline in healthy lifestyle behaviors. And I think we're going to suffer the consequences of this pandemic for many years down the road, because there are declines also in physical activity. Unhealthy eating has become a pattern for a good percentage of the American population. And we've also seen an increase in alcohol use as people try to cope or emotionally regulate feelings of stress, depression, and anxiety. So before the pandemic, 1 in 5 children and teens had a mental health problem, yet less than 50% were getting treatment. The new numbers indicate this could be escalating to 1 in 3 children and teens suffering from a mental health issue. Anxiety, depression, and ADHD are the 3 most common mental health disorders in children and teens. And very sadly, suicide is now the 2nd leading cause of death in 10 to 34-year-olds. However, there is hope, because if we can build resiliency coping strategies that are evidence-based in our children and teens from a preventive standpoint, we might be able to ward off the number of children and teens who are diagnosed with mental health issues. There's a lot of risk factors for mental health issues in children and teens. We do know there is a genetic component of mental health issues. Poor self-esteem, lack of developmental assets like coping skills, optimism. So many children during COVID are being exposed to increases in interprofessional violence. Child abuse is up right now due to the stressors caused by COVID. Put on top of that, bullying. Our social media is contributing to a lot of anxiety and depression in our children and teens. And then there are the social determinants that also have a major factor as risk for mental health issues. So I'm going to talk first about anxiety. Anxiety is a complex pattern of reactions to a perceived threat. Children and teens who develop anxiety disorders, there are classic worriers. They worry about almost everything. But cognitively, they're forgetful. They often have decreased attention. In fact, there are a lot of children who are misdiagnosed with ADHD when the underlying disorder is either anxiety or depression. But there's also a lot of comorbid conditions that occur. Children who have both ADHD and anxiety, or anxiety and depression. Behavioral signs of anxiety include anxious tapping, being restless, physiological symptoms like fast heartbeat, sweating, palpitations. And I really want to point out somatic symptoms, headaches and stomach aches, are really common in children and teens who are suffering from anxiety or depression. It's common for children and adolescents to have fears and worries. On this slide, I have mapped out common fears and worries by specific ages. By the age of 9, children realize death is final. That's why also a reason COVID is causing a lot of anxiety for children age 9 and above. They're scared of catching the virus. And is somebody from their family going to catch it and die? Adolescents, they have a lot of fears and worries related to social competence, to school, to their peers. But death is another common fear and worry in teenagers. The big red flag is when these fears and worries start to interfere with their concentration or their functioning. Now let's take a look at signs of depression. Yes, infants, toddlers, and preschoolers can get depressed, just like they can have anxiety disorders. What you tend to see in young children suffering from depression or anxiety, they have what's called externalizing behaviors. They often get into behavior problems or excessive tantrums, get aggressive, get irritable, have sleep problems. And a coping strategy used by these younger children, they often tend to regress, go back in time to a point where they feel more comfortable. So a preschooler might start wetting the bed again or sucking on his or her thumb. Signs of depression in school-age children include sadness, irritability, and anger, crying spells. Complaints, a frequent one is nobody likes me. But somatic complaints are so common in school-age children. Complaining of belly pain, chest pain, headache. And then, of course, a drop in grades that begins to occur. Depression often can be misdiagnosed as attention deficit hyperactivity disorder in this age group. Because again, a lot of children who are depressed or anxious, they get restless, they get irritability, they have trouble concentrating. Well, then we move to adolescents. Adolescents, when they are depressed, they look a lot like adults who are also depressed. So they get sad, hopeless, but there's a lot of self-hatred there sometimes. In addition, angry outbursts. Again, so many adolescents who have angry outbursts. People look at those teens sometimes and misdiagnose them with behavioral disorders instead of looking further into anxiety and depression. They might sleep more or less. They may eat more or less. Drug and alcohol use is common because they don't know how to cope in healthy ways with these emotions that they're feeling. Comorbidity, having anxiety and depression at the same time is extremely common. But the good news about anxiety and depression occurring together is that the best first-line evidence-based treatment for both of those conditions is actually cognitive behavior therapy. So whenever you see these types of symptoms in your child or your teen, and they're interfering with their cognition, their concentration, or their functioning, and they are persistent, they're lasting longer than 2 weeks. Intervention is definitely needed, and the sooner the better. Because if we don't effectively treat, for instance, depression, the first time that a child or teen experiences it, the chance of recurrence is about 60 to 70%. So cognitive behavior therapy or cognitive behavior skills building is the first line evidence-based treatment for depression and anxiety in children, teens, and adults. If you take your child to your pediatrician to talk about symptoms or signs like this that you're worried about, and if that physician or nurse practitioner says, I think we need to refer your child to a mental health counselor, ask for one that specifically does cognitive behavior therapy. I've put on this slide 2 wonderful websites where you can search for cognitive behavior therapists. Again, CBT, gold standard evidence-based first-line treatment for depression and anxiety. You all heard the lecture that I gave on using cognitive behavior skills building, because the root of depression and anxiety is typically a negative pattern of thinking. So we've got to get to that root and teach these children and teens how to pick up negative thoughts, turn them around to positive to feel better. We emphasize this thinking, feeling, behaving triangle in CBT. We also teach the ABCs in CBT. Monitor for activators. Those are stressors that typically cause a negative thought. Learn how to stop the negative thought, turn it around to a positive to feel better. So if you can help your children to catch their negative thoughts and turn them around, they're going to experience much less stress, anxiety, and depression. When you see your child escalate in terms of stress, anxiety, depression, stop them and say, Johnny, Sally, tell me what's going through your mind right now. What are you thinking? Get them to verbalize that. For younger children, that's a little tougher, but younger children often will tell you how they feel through their dolls or their stuffed animals. So asking them questions like, how's your little doll feeling right now? How's your little bear feeling right now? What do you think they're thinking? To be able to get into the thought pattern of your younger children. With school-age kids and teens, you want to say to them when you see them stressed, tell me about what's going through your mind right now. Do you think it's helpful to think those thoughts? Do you think that thought is really true? Do you have the evidence to back it up? 99% of the time, the answer is going to be no. So again, helping your child tune in to their thought patterns when stressed, anxious, or depressed is really important. Just like behavior change, it takes 30 to 60 days to really begin to train and change your pattern of thinking. So there's many positive ways to teach children and teens how to cope. We want to encourage them, talk about how they feel, talk about, for young children, how their stuffed animal or doll feels. Make sure they're getting physical activity in. Physical activity for kids, in addition for their cardiovascular and immune systems, is such an important outlet for stress. Writing their thoughts down and feelings in a journal, really important. And helping your children to be mindful in the present moment. Learn how to bring their thoughts back to right here, right now. We teach self-regulation of emotions to children and teens through positive self-talk, counting to 100, saying the ABCs, teaching children how to take big abdominal deep breaths when stressed. Walk away when you feel yourself escalating with anger. So again, preempting crisis situations from happening by teaching children how to regulate their emotions is critical. If your child is suffering from a lack of confidence, if they're suffering from poor self-esteem, daily positive self-statements can really help your children. It may feel weird at first to do them, but we've got a lot of research that shows if your child can get up every morning, every night, pick 2 positive self-statements. I am strong. I'm a good friend. Whatever they need help with, say it over and over. It helps to rewire the brain more positively. This little girl does an excellent job of showing you daily positive affirmations work.
Now my whole house is great. I can do anything good. I like my school. I like anything. I like my dad. I like my cousins. I like my aunts. I like my Allisons. I like my mom. I like my sisters. I like my dad. I like my hair. I like my haircuts. I like my pajamas. I like my stuff. I like my rooms. I like my whole house. My whole house is great. I can do anything good. Yeah. I can do anything good.
Now, this little girl is not going to have an issue with self-esteem. Get your kids in the habit of doing this in the morning and at night, as well as reading 5 minutes in a positive book every morning and before they go to bed at night. That's a habit I established about 25 years ago. I still do that. We get bombarded with a lot of negativity sometimes during the day. But if you can wake up every morning and get in the habit of this practice, again, it rewires the brain to be more positive. Well, there's a lot of ways to teach children to be more mindful. You can give your child a piece of gum, ask them to count the number of chews it takes until it loses flavor. Make clapping sounds. Have them repeat your clapping sounds. and great apps to teach mindfulness, to practice it for children, Headspace and Calm. And starting at the age of 9 or 10, a great book to have your children read that teaches why mindfulness is so helpful is called The Present by Spencer Johnson. Would we ever send a diver into a deep ocean without an oxygen tank? The answer is no, we wouldn't. How can we send our children throughout life without teaching these very important evidence-based skills to help them ward off chronic stress, depression, and anxiety? These are the skills to help build resiliency. If we can focus just 30 days on each of these to try to help our children become more resilient, we will do them so much good in life. Optimism is a protective factor. This clip is an awesome example of a little boy who's got a lot of optimism.
I'm the greatest hitter in the world! Strike one. I'm the greatest hitter in the world! Strike two. I'm the greatest hitter in the world! Strike three. Wow! I'm the greatest pitcher in the world! Optimism. Pass it on.
So another last key strategy to really developing this wonderful resilience in children and teens, gratitude. I can't emphasize gratitude enough because, again, if established as a habit, there's going to be much less depression and anxiety. So in your house, create a gratitude board like you're seeing on this slide. And when you wake up every morning, encourage your children and you yourself to write down 1 or 2 people or things you're grateful for that day. We're getting bombarded with so much negative media, and I can't impress upon you enough how critical it is to limit negative news and social media with your children. It's also important to maintain structure. I know it's tough because of the pandemic, but children feel safe when they have structure, routines, and when families plan activities that they can do together. Lastly, your anxiety, mood, and how you role model coping with stress is absolutely going to affect your children. We as parents have to walk the talk. Our children will often do and respond as we do, but you've got to prioritize your own self-care. You cannot take great care of your family without taking care of yourself first. You cannot pour from an empty cup. So whatever it takes, I really urge each and every one of you, make sure you're prioritizing yourself a little bit, 4 or 5 times a week, going for a walk, practicing stress reduction. You'll be a better parent. Your children will benefit from that. Lastly, remember, cope with COVID. And I want to end by giving you hope. If your child or teen is struggling with a mental health issue right now, it is nothing to be ashamed about for you as a parent. You're doing the best job you possibly can. There is hope. There is effective evidence-based treatment, but the sooner you get it for your child, the better. So with that, thank you for attending our Stay Calm and Well 2 series. Stay tuned for Stay Calm and Well 3. Best wishes, stay well.
All right, Bern, do you have time for a few questions?
Yes.
All right. I don't think we're going to be able to get to all of them, everyone, but we'll try to get the top couple in here. I know Bern has to go pretty quick for another meeting. So with that, we'll get into it. The first question is, as we get closer to Election Day, a lot of people are getting more depressed and anxious due to the political climate in our country. Suggestions for dealing with the mental health issues surrounding this?
Yes. Again, I can't tell you how important it is to limit exposure. Limit TV time, limit media time, and practice gratitude. The focus, again, so often we focus on things we can't control. Try and keep your children, yourself focused on what you can control every day. You can control getting up in the mornings, practicing a little bit of gratitude, and so on.
How do you help 18 to 21-year-olds? They are adults, in quotes, and I am no longer allowed to schedule medical or mental health appointments for them, and they may not do it themselves.
Yeah, I think the biggest thing with them, get them talking. Get them writing in a journal. Absolutely approach them in a helpful way. So many times, if you have an adolescent with a mental health problem and you're frustrated because as a parent, you want to get them help. But sometimes parents can overstress and overdo, which actually shoves those teens a little bit further away. A good way to start that conversation is to say, you know, John, Susan, I see X, Y, and Z. It concerns me. Talk to me. How are you feeling? How are things going? Approach it in that way. And then, of course, to suggest, you know, what I'm seeing in you, I think you could use a little help. Here's a couple people who might be able to help you, and put that in front of them.
Okay. Have you seen a disproportionate increase in anxiety and depression with kids of racial or ethnic minorities?
Yes, research absolutely supports that. Underrepresented groups often have even higher levels of anxiety or depression, but I'm going to say anxiety and depression affects all age groups, high socioeconomic groups, middle socioeconomic, and low SES. It's super important to monitor for signs and symptoms. And I can't stress enough, prevention, prevention, prevention. These types of skills need to be taught in every school in the country. We spend a lot of time teaching kids writing, math. Those are all great and they're essential skills. But what's more essential than our kids learning protective strategies that they can use so they won't get depressed, anxious, suicidal? I could go on for many minutes talking about how critical it is to turn our current paradigm from crisis intervention and sick care to prevention and well care. Anybody, if you have any further questions, don't hesitate to email me at melnyk.15. I'd be more than happy to communicate with you about any last questions. Stay well, go Buckeyes.